So welcome back, everyone. My next guest is Dr. Ben Hill, and he's the owner of Mission PT. You know, it's a new year. There's a lot of people out there that they've been trying to get healthy, so they've been going to the gym. They might have hurt themselves. A lot of people, if you don't know what you're doing, that can happen. You might be suffering from arthritis or some kind of a disease or whatever. You don't need to be in pain.
That's right.
You can be healthy. So, Doctor, welcome back to the show. You've been on the show before. I can't wait to have you on because we're going longer now. And I want to talk to you a little bit, tell everybody a little bit about yourself and what we're going to talk about today.
Well, it's good to be back, Carol. My name is Ben Hill, like you said. I've done physical therapy for almost 15 years now and relatively new to the Valley. Opened up Mission Physical Therapy about 3 years ago. And we have a great approach to working with all sorts of orthopedic conditions as well as dizziness and balance problems.
Okay, so now, first of all, I want to talk to everybody about something that we're going to talk about today. It's kind of neat, and you're going to do a giveaway of this, so that's why I want to bring it up right away. You are going to talk a little bit to them about it's a dry needling.
That's right.
Now, I know it sounds weird because when I heard it first, I kind of thought, ooh, well, okay, let's talk about it, what it is, and then we're going to do this giveaway. Listen up, this sounds great. Go ahead.
Well, dry needling, I think, got its term primarily from the idea that doctors typically inject people in trigger points and in other areas with some sort of medicine, like lidocaine or a steroid or an epidural, those sorts of things. And there were doctors decades ago who started to have the idea that maybe it wasn't what they were injecting, maybe it was the needle that was causing the benefit, that was giving the results. And so they began dry needling, needling without any medicine or injectate.
Okay. Does it hurt? That's what we want to know.
I think most people who have it will have some discomfort, like some mild muscle cramping or feel a little poke. It's definitely a lot less of a poke. Than
it goes in, though, the skin.
It penetrates through the skin into muscles along, tendons, ligaments, different things like that. It depends upon where the person might have pain or a problem.
Okay. Now, who would be the candidate for that?
Well, dry needling is used for all sorts of different things. It's used for headaches, migraines, TMJ problems, problems with people's jaw, the jaw, and neck pain, back pain. You can have sciatica or some sort of radiculopathy with pain going down your arm or your leg, your lateral epicondylitis or tennis elbow, Achilles tendonitis. It works for so many different things.
Okay. We're going to open up the lines here if it's okay with you, because I want to let everybody get this entered in to win. It's a 1-hour assessment, and you get 3 dry needling treatments. This is a $250 value, free to you guys out there. Our number here, 602-277-5369, and toll free, it's 1-866-536-1100. You do consultations. You do free consultations with people?
We do. Yeah, we often have people coming in just wondering whether or not physical therapy is something that can help them. And
well, that's another thing that we want to talk about too. But I wanted to get this out for everyone. So our lines are open here, 602-277-5369. You could check them out. It's missionptaz.com, or you can call them direct at 480-550-9100. They're rated with the Better Business Bureau. Call in here. I'm going to even let, if you have a question and you want to ask, if that's okay, Doctor, we're going to even let them ask a question. Our number here again, 602-277-5369. Okay, so let's say I wasn't in a car accident, or I didn't just have a knee replacement. I didn't even break my back. I'm not paralyzed for life. My knee just has been achy off and on for a long time. Why can physical therapy help me?
Well, a lot of people have different aches or pains that come about during the course of their lives, and a lot of times it just gets blamed on, I'm getting older, or maybe this is some old injury that I had years ago, and it's just kind of bothering me or nagging at me again, or maybe this is something that runs in my family. Those 3 reasons, unfortunately, don't have a good solution. I can't make anyone younger. I can't change their past, and I can give them a new family history. That's just the body you're born with. But fortunately, unfortunately, most orthopedic conditions occur or continue to plague us because they affect the way that we move. It interferes with the movement that we need for normal everyday life. And so we focus on the way that people move. We provide interventions, whether it's hands-on techniques or our skilled training, postural re-education, ergonomics, body mechanics, different things like that to restore normal, healthy movement again. So most people come in with some sort of ache or complaint that they have, and as we restore their motion, they find it's easier to move and it doesn't hurt.
So it's really not normal to hurt in any way.
That's right.
So
it's not normal to hurt.
Do you feel that people out there should be having physical therapy? Basically, we all are sitting wrong. We're all doing everything wrong, standing wrong, whatever. So do you think we all should have physical therapy?
I think pretty much everybody. It applies to just about anybody I meet. There's somebody, I can't go to church or go to a restaurant or go just about anywhere. If someone finds out that I'm a physical therapist, they're asking me about some problem they have.
Right.
And fortunately, my profession has given me the tools to provide some answers.
And, in terms of it, let's say you have arthritis, or if everybody's been told, I love that when you go and you have an MRI or whatever, and then they're said, well, it's arthritis. I don't know if I believe in that, Doc.
Yeah, it's definitely discouraging, especially when you Google it and you find there's no cure.
So we have our lines open here. Our number here is 602-277-5369, and toll free it's 1-866-536-1100. If you have an ailment and you're hurting in any way and you want to call and ask the doc, he's here live to talk to. I like to say the doc is in to answer some questions if you'd like. Our number here again, 602-277-5369, and everyone's getting entered into win a 1-hour assessment, and that comes along with 3 dry needling treatments. That's if you want them. We'll put it that way because it sounds a little bit hokey, but it's not. And it sounds awesome because you know what? Well, I've had my father used to get those cortisone shots, which is a shot that you would not do the cortisone. The cortisone hurt more than anything.
Yeah. Well,
so it was really not the shot that
hurt. And the needle's big.
Yeah. So this is not.
No.
That's why we want to get that.
Yeah. The largest needles we use are only 1/8 of the size of what a doctor typically uses. So much smaller, a lot more comfortable.
So you get that. This is a $250 value free to you or anyone you know. Our number here, 602-277-5369. You could check him out. It's missionptaz.com or call them direct at 480-550-9100. They do free consultations as well. What about if somebody is, give them some ideas right now, because let's say somebody out there is hurting right now. They've got a terrible back. Do they put ice? Do they not put ice? What do they do?
Yeah, there's a lot of conflicting opinions out there on whether to use heat or ice. Our body tries to maintain 98.6, our temperature. If you warm up an area, how's your body going to cool it off? Well, it sends more blood there. It increases the blood flow. Your capillaries vasodilate and open up, and you get more blood flow, and it cools off the area. If you put a cold pack on your low back, your blood vessels will vasoconstrict or tighten up a little bit at first for the first 2 to 3 minutes, but the whole reason why you turn pink is because then they open back up again because they're trying to warm that spot up. So in both cases, even though you're using opposite temperatures, in both cases you get increased blood flow. So it really comes down to your opinion on which one makes you feel better. Some people get tight with ice. Other people love the numbing effect. Some people find they're achy with heat, and other people find it's very relaxing.
I thought it was like 20 minutes on, 20 minutes off, and
and then there's
kind of
the
rotating.
Advice to alternate. That's right. That's right. But the point is to choose the one that seems to help you the most. It's really subjective.
So now I know that if you were calling in and you wanted to ask a question, if you don't get in, we're going to go to a break. When we come back, we want to talk further. Again, our number here is 602-277-5369. Toll free, it's 1-866-536-1100. If you have an ailment in any way that is painful, you don't need to be in pain, and the doc is here to answer some questions if you'd like. Also, we've got our lines open here for everybody to get a 1-hour assessment, that if you want the 3 dry needling treatments as well. Our number it's a $250 value free to you or anyone you know. Our number here, 602-277-5369, and toll free it's 1-866-536-1100. You're going to get that. They're rated with the Better Business Bureau. They also do free consultations. Their number, their direct, it's 480-550 800-910-9100. We're going to go to a break. When we come back, what advice would you give somebody who's sitting in the car right now with a backache?
Oh, don't sit for too long. We'll talk about some stretches you can do when we come back on.
Again, our number here, 602-277-5369. Toll free, it's 1-866-536-1100. Get a 1-hour assessment. If you want the 3 dry needling treatments, they're awesome. It's $250 value, free to use. 602-277-5369.
For trading it all.
Welcome back. We're talking with Dr. Ben Hill. He's the owner of Mission PT. Before we went to a break, I had asked you to give some kind of what did I say? Solution for people who have back pain that are driving right now.
That's right. It's not a good place to be. This might apply to somebody who's stuck on a flight and feels like a sardine in a can and they have those little tight seats. Without even getting up, especially while driving, obviously you can't get up, but you may just be able to sit there, slouch down as far as you can, hold 5 seconds, and then sit up as tall as you can, arching your back, and hold 5 seconds, and go back and forth, alternating between those two positions until the symptoms go away.
Wow.
It usually just takes
something
that
as
little
simple
bit of
as
movement.
that. So again, and the guy behind us is going, my board operator's got his thumbs up. He's saying thank you. So that's great advice. Now again, we have our lines open here. We are going to talk a little bit further about this dry needling. First of all, let's talk about it again so that we can go more narrow on it. How did it come around, and what makes it so awesome?
Well, most people have heard of the Chinese traditional Chinese medicine, which includes acupuncture, and the Chinese have been using thin monofilament needles for centuries, really, to treat all sorts of different ailments. There's a lot of guesswork in it, but they have time on their side where they passed along the results that they had to one another, and have had great results over the centuries. With dry needling, like I said, it has more Western roots, where doctors who had given patients injections for different problems began to wonder whether or not it was really the needle as opposed to the medicine they were injecting that was giving the results. So they began to think, instead of a hollow bore needle, which is large, that they might use something thinner like an acupuncture needle. And Dr. Lewitt in 1979 published the results of over 80 different locations where he got favorable results for his patients without injecting anything. So what happens when you put a needle in there? I would never think to put a needle in some place where I hurt to help me feel better. That just doesn't seem logical. But what we know about the body and how it heals is that when there's some inflammation somewhere because you've hurt something, you've sprained a ligament, you've torn a muscle, when you've done some damage, the healing process starts, and that inflammation somehow triggers your muscles to tense up. Well, tense, tight, cramping, knotted muscles, trigger points, if you will, don't allow good circulation through the area. And so that area becomes deprived of the oxygen and nutrients and blood that you need to heal. And in the absence of oxygen, the tissue there will become fibrotic, and you'll get excessive scarring in the area. Needling that area will actually disrupt that cycle. It'll make the muscles, the trigger point of the muscle, relax. It increases the blood flow. Repeatedly needling the area, you can do needling a couple times a week. Has been shown to increase angiogenesis, which is basically the growth of new capillaries, which are your tiniest blood vessels. The body has also been shown to release opioids and norepinephrine, different painkillers, in areas that have been needled, and scar tissue seems to thin out or break down. So you have some really positive, measurable results.
If you have had back pain for a long time, and there's a lot of people that live with it, how long, is there a point where you can't really reverse it, or can you always do something to help?
I think it's always great to tackle it right away, but that's not always the case for everybody. There are a lot of different circumstances, or sometimes just you may not be aware of what's available to you, or you might be afraid. Mm-hmm. I've worked with people who've broken their backs. I've worked with people who've had rods and hardware put in their backs because they've had fusions, and unfortunately didn't get the relief that they were hoping for. Fortunately, though, there's a lot you can do later on to disrupt that cycle that they're stuck in. God's made our bodies to heal themselves, and to me, if someone has chronic pain, something happened in the healing process. Something blocked the path to healing. And dry needling is one tool that we have that seems to reset the system. It's a way of tricking your brain into thinking, oh, I'm injured again. Let me try to heal that area. And yet, when you remove the needle, there's no evidence that it was there a few hours later. You just can't even tell. So it's a great way to reset the healing system and get your body on the way to recovery.
How long do the needles stay in?
Research shows that leaving them in for anywhere from 10 to 30 minutes is more beneficial than just putting them in and taking them out immediately. But both approaches are beneficial.
Now, it's obviously safe, and but it is quite popular now, right?
It is, and there are different things a practitioner can do to increase the safety. We use sterile, brand new, disposable needles that are never reused. We always purchase high quality stainless steel needles. We take precaution. Physical therapists have been shown to know their anatomy. I think second only to
acupuncture, sort of, without any. Right?
Well, I can't speak on an acupuncturist's background or training, but physical therapists spend 6 to 8 years studying to provide physical therapy, including dry needling. So their knowledge of anatomy is excellent.
We've got our lines open here for everyone to get entered in to win a 1-hour assessment. That's either for you or someone that you know. You can get the 3 dry needling treatments if you like. That's comes with that. It's a $250 value, free to you. Our number here, 602-277-5369, and toll free, it's 1-866-536-1100. Check them out. It's missionptaz.com, and the phone number to call them direct. They do free consultations. It's 480-550-9100, or you can call in here and ask a question really quick. The doc is about to be off the air soon. So 602-277-5369. So does somebody, how do they get lasting results without having to go to a physical therapist? Does that happen or what?
One of the first things that attracted me to physical therapy, as opposed to some of the other disciplines out there, whether it be chiropractic or massage, is that physical therapists really try to approach a problem by what is keeping this person in pain? What is it that they're doing? What position are they getting in? How are they moving that keeps them in pain? And when you learn what's causing your symptoms, you can change that. And so we also try to provide our patients with tools. If I've done something to make somebody bend over better, you can expect me to teach you how to keep those results.
What's the difference? You brought something up, and when you said, you're obviously different than a chiropractor.
Yeah, there's different training. There are different schools of thought. Physical therapists, many.
Because we always think we need to go to the chiropractor. My back went out. I need to go to a chiropractor.
That's right. They're very well known for their adjustments, the treatment that they provide for anything related to the spine. Physical therapists also learn manipulation or mobilization of the spine and other joints. And we have an approach where, in addition to restoring normal joint mobility, we want to restore normal muscle tone to the muscles surrounding the spine. I would also consider the way somebody moves. Often, how many times do you see somebody walking around with an ankle boot on? They've got their foot in a boot because they broke their foot. How's your foot doing? And they respond, my foot's not doing bad. It's my back that's killing me. Why? Well, because they're gimping around in a boot. So, of course, it's going to affect their back. Mm-hmm. Well, I had a great mentor years ago who said, Ben, wouldn't the same thing happen if the next person you see with back pain comes in and their ankle is just tight? You've got to look at it holistically. You got to look at the whole picture. So when someone comes in with low back pain, I'm looking at whether or not their ankle moves appropriately, whether or not they've got appropriate hip mobility, and then whether or not they're using it, whether or not their body mechanics, is allowing them to load the larger muscle groups of their legs and those larger joints instead of loading their back all the time.
And a lot of people favor, let's say you've been
That's right. They begin to compensate.
Right. Yeah. And then you're definitely not doing yourself any favors by doing that, correct?
Yeah. And so instead of giving somebody some exercises that they can learn easily on the internet, we're doing retraining. It's like working with a golf pro or a pitching coach. We're giving you retraining exercises to teach you how to move better.
Well, you can check them out. They're at missionptaz.com. Their phone number to call direct, it's 480-550-9100. They're rated with the Better Business Bureau. We've got our lines open here, and I'll let everybody keep on calling for the next 5 or so minutes. You're getting entered in to win a 1-hour assessment that comes along with 3 dry needling treatments if you want them. It's a $250 value. I think you need to find out about them. I think that's for sure. People want to understand what they are. It's not like, we're giving away a weed whacker on that,
That's
Doc.
right.
But it is quite different. And I do think that people, it's wonderful that this is an option for them. And I think that I would like to have to not have that injection of something in me. I don't want that in my body.
Yeah, it's not too uncommon that somebody will be lying down for a dry needling appointment, and they've asked if I've put any in yet, and I might tell them, well, I've already done 5.
That's funny. How about this arthritic person? A lot of people might be listening that have that. Give them something you want to say about that right now, real quick.
That's right. As far as arthritis goes, if you're bone on bone and your knees are killing you, and you're looking at a knee replacement or some other surgery, you'd be surprised what dry needling. There's a protocol that we do for knees, in addition to restoring your mobility and improving your body mechanics, so that you load your hips more than your knees, and people get great results.
The number to call here for getting entered in to win a 1-hour assessment and 3 dry needling treatments. It's a $250 value, free to you. Our number here, 602-277-5369. Toll free, it's 1-866-536-1100. They're rated with the Better Business Bureau. Their website is missionptaz.com, or you can call them. They do free consultations. It's 480-550-9100.